Arkansas actually has the third highest rate of snake bites of any state in the U.S. There are about 7,000 snake bites each year in the U.S. Thankfully, of those, only about 5 or so will be fatal. Most snake bites actually happen in someone's own yard or a place that they're familiar with. But in general, most bites are provoked, either from the person trying to touch the snake, pick up the snake, etc. Things you can do to try to prevent getting bit by a snake in the first place: wearing protective clothing, especially if you know you're going to be in an area with tall grass, thick brush, working around wood piles or other matter where a snake might hide. So you can wear tall snake boots, leather gloves. Also just looking before you reach into any particular places. Trying to, if there is a path, trying to stay on the path. Overall, the majority of bites will be dry bites. So even if it is a venomous snake, only about somewhere between 25 to 40% of those are actually envenomations. However, up front, you're probably not gonna know. And so it's generally recommended to get to medical care where you can be observed. Some blood work can be checked and be watched. If you don't need antivenom, great, but if you do, that way you're there and can be treated as quickly as possible. So if you have been bitten, number one is just try to stay as calm as you can. Number two, you can remove anything on the site that's constrictive, like jewelry, tight clothing, because that could hurt the local tissues and cause further swelling. Try to immobilize the affected extremity as best you're able to keep from using it, and keep it elevated, but just below the level of the heart. Most of the other things you hear about, whether that's trying to cut or suck out the venom, tourniquets, trying to shock yourself, none of that is effective or recommended. There's a saying that the best snake kit is actually a set of car keys and a cell phone. There's not a lot you can do in the field. Try to get to medical help as quickly as able, whether that's calling an ambulance, if you have someone that can safely drive you.